Dr. Thompson, welcome to the podcast. It's really nice to connect.
Thank you. It's a pleasure to be here.
Yeah, I've been really looking forward to this conversation. I think some of your research is just really fascinating, and it's something that I've been aware of for a while. And it's popped up in different ways in different books, and I'm really interested to pick your brain on this topic. But before we dive into today's conversation, are you happy just to introduce yourself, really, for anyone that might not be familiar with you yet?
Yeah, absolutely. I'm very happy to do that. And what I'll do is I'll try and make it as relevant as I can to the audience, and also to relevant to, if you like, the book and the research. I mean, the book is about survivors, and survivors I've sort of defined as people who've got illnesses that don't normally get better with conventional medicine. Things like cancer, particularly metastatic cancer, progressive neurological disease, perhaps some autoimmune disease, things of that nature. And basically the story probably starts several years after I went into general practice. Now, general practice, certainly modern medicine is pretty good if you've got acute illness. If you've got a pneumonia, if you've got an appendicitis, if you fractured your leg, modern medicine is really going to help you. Some of the diagnostic techniques, which have got a lot better over the time I've been practicing, are very good as well. But where it falls down is on chronic disease. Drug treatment is rarely a cure for a chronic disease and can have, a long list of side effects. Cancer, some cancers do very well, but overall, in 30 years, the survival has gone up 0.7%. So not that impressive. So I was beginning to feel that there was something missing, something I needed to look for. And I joined British Society of Ecological Medicine, as it has now become. And that's a society which deals with nutrition and more recently toxicity and related subjects. But at the time I went along, it was mainly food allergy and food intolerance. Now, despite that, there were some remarkable doctors there who were getting extraordinary results. And one in particular was, this is Dr. Patrick Kingsley, sadly no longer with us, but he was treating what were then called no-hopers with cancer, with nutritional infusions and other things, and getting outstanding results. Equally, he treated about 9,000 people with multiple sclerosis, again, using nutrition, sometimes removing amalgam fillings, getting outstanding results in a lot of the patients. And I thought here, wow, how is this possible? How is it that no one in medical school told me about this? Because after all, doctors want to help patients cure their illnesses. And I hadn't been told, I hadn't been given this information. Anyway, as time went on, I learned a little bit about NLP and hypnosis, because you see a great variety of psychological problems in general practice. But even there, I found there was practitioners, and they were getting astonishing results as well, using the power of the mind. For instance, they were having results in cancer and with AIDS. And again, I thought, why did no one tell me this was possible in medical school? But in both cases, with the nutrition and with the psychological problems, survivors were ahead of me. They already knew that diet was crucial to getting better. They already knew the power of the mind. I mean, some of the techniques fairly well known, like visualization in cancer, but they were doing more than that. So I was gradually learning. In 2003, they decided to build an incinerator near where I lived. At the time, I knew virtually nothing about toxicity. But if you're a waste operator or a member of a council, incinerator is like a dream. Instead of having to landfill all that rubbish, suddenly it's gone in a puff of smoke. Well, of course, things are never quite that simple. And as I was to find out, what happens with the waste is it turns into these particulates, particularly below 0.25, which they're so small, they get through the lungs into the body. So what was actually happening is the waste was being turned into these particulates, which were becoming parts of our body, and of course part of the air, which wasn't really a great idea. So I had a steep learning curve about toxicity, and in fact I produced a leaflet eventually, but that was the tip of the iceberg. And really what I realized is with each generation we were getting more toxic, the world was getting more toxic as well. So I learnt all this about toxicity, but again, I thought, why had no one told me about that in medical school? And how come survivors yet again were ahead of me? They already realized they needed to avoid this stuff. They needed to get it out of their body. During the course of that time, I learned a little bit about energy medicine as well. I did electrocrystal therapy, EFT, some kinesiology. So that sort of came into it as well. But what I realized, I was on a sort of learning journey, and it might surprise some of the listeners, but after 10 years of medicine, the first 10 years of medicine, I knew very little about health and disease. And I gradually learned more as time went on. And I was on the same learning trajectory as people with serious illness, except they had to learn it much faster than me. So I thought maybe if I could put this in a book so it was available to people, it would save them a lot of time learning this stuff. So that's a sort of potted history of how I came to write the book, really.
That's brilliant. So as is often the case, I guess, there's a personal element to the story in regards to the incinerator and how that sparked your, I guess, awareness.
Yes, and it's interesting because really about the same time, BSEM started to get much more aware of toxicity, probably some members of the medical profession, but sadly most of the medical profession are unaware of it, partly perhaps because they have no test for it. So they don't know if a person's developing increased toxicity or not.
Yeah, no, absolutely. And I think your book does such a great job of breaking this down for us and looking at arguably the most important elements of this, because obviously you've mentioned diet and how important that can be and how some of these survivors are ahead of the curve, so to speak, from that perspective. You've mentioned toxicity, but the other two big things are the mind and energy as well.
Indeed.
So
Yes.
what's the best way to kind of start to introduce sort of, I guess, your book ultimately, which obviously is called Curing the Incurable Beyond the Limits of Medicine for people?
Well, Alex, maybe we could start with a case.
Brilliant.
To give some idea of the way it works. And this case is in the introduction, and if you go to my website, you can actually read this. But this is a classic survivor, and this is Elaine Nussbaum. When we meet her, she's in her 40s. She's got a uterine sarcoma, and this is a disease which has never been cured before. So the odds are against her. In addition, it's spread, it's metastasized to a spine and to a lung. She's having nearly 40 pills a day. She's in a wheelchair, and she's got a neck brace, and she's in constant pain. And you might think there is no hope whatsoever here. I think most people would say that. However, she heard about a Dr. Satilaro. This was a doctor who had treated himself with macrobiotics successfully for prostatic cancer. So she thought she would give it a try. And fortunately, she found a therapist who had expertise in macrobiotics and was also a healer as well. So she started the treatment. She had faith in the therapist, and she had faith in the diet. And within 6 months, she was free of all tablets and she was free of pain. So that was a good start. After 2 years, she had x-rays done, and the x-rays showed the cancer in her lung, the metastasis in her lung had gone, and so had a spinal metastasis. 22 years later, she wrote the book, Recovery from Cancer. She was free of disease. Now, you might ask, how is that possible? And I would say the reason it's possible is the body has unlimited healing capacity. But, and it's a big but, that's if everything is in place for healing. In her case, it was. She has a diet which was good for her. She had a belief in the treatment and the therapist. She believed she was going to get better. And she was having shiatsu, so energetically, things were right for her. Everything was in place for healing. So this astonishing healing took place. And I think that's maybe a good starting point. And there are many examples like that in the book, but it is perhaps a dramatic one.
Yeah. So would you be happy just to expand on this concept of macrobiotics?
I must say I'm not an expert on macrobiotics. Maybe would it be useful to go through the dietary side at the moment and include it?
Yeah, that sounds great.
Because as you rightly say, the 4 sections of the book, the diet, the mind power, using energy, and toxicity. In terms of diet, quite a lot of diets have been used. And at the start of the chapter, I give a case of multiple sclerosis. But I would say the book is somewhat biased towards cancer, simply because that's perhaps the commonest disease where we see survivors these days. So if I start with the research of 200 of cases of spontaneous remission of cancer. That was a paper by Dr. Harold Foster. Now, the interesting thing about these cases is the majority had metastatic cancer. As you probably know, metastatic cancer is largely thought incurable in mainstream medicine. And yet these people all recovered. The title spontaneous remission I don't think is entirely appropriate, because 87.5% used major changes in their diet. Some also used some detoxification processes. And they tended to use diets which were based on fruit and vegetable juices, and cutting out meats, dairy, sugar, refined products, etc. So that gives you a rough idea of what they were doing. Now, let me give you another example of a healing diet. You've probably heard of things, obviously things like the Gerson diet, which is rather similar in which you use fruit and vegetable juices. We've talked about the macrobiotics, which, as I understand, is largely a raw food diet. Okay. And let's talk about William Kelly. Now, he was a man who developed pancreatic cancer in his 30s. He was a dentist. Now, as you probably know, with pancreatic cancer, most people are dead within 6 to 12 months. It's a pretty lethal disease. However, with William Kelly, he started to notice something which no one had noticed before. And that's that the metastatic nodules in his liver would swell up with certain foods. If he had sugar, if he had white flour, if he had meat, if he had dairy. Also, if he had certain other foods, fruit, vegetables, nuts, particularly carrot juice, they would go down in size. So he bought himself a little bit of time, so as to speak, and he started to get better, or at least stable. However, he was a great reader, and he read about Professor Beard, who in the early 20th century, right at the beginning, had published work that pancreatic enzymes could cure cancer. And he'd shown this in animals, and I believe in the odd case in humans. So Kelly, uh, ever the investigator, tried himself on the pancreatic enzymes, and it was so effective, he rapidly became toxic from all the cancer cells dying. At the time, the treatment for toxicity was to use coffee enemas. Coffee enemas had been used since Florence Nightingale. And it was in the Merck manual at the time, so he used that, and he found that an effective method of reducing the toxicity. So this combination of a diet, which again was a raw food diet with fruit and vegetables, plus his pancreatic enzymes, plus his coffee enemas, a little bit similar to the Gerson diet, really. To cut a long story short, he got better. Doctors were surprised, not surprisingly. They sent patients to him, and he went on to treat about 500 other patients with various cancers with success, with a 50% success rate, I would say. And these were people who hadn't responded to standard treatment, so that was pretty good. He even wrote a book about it. I think it was modestly called One Way to Cure Cancer. But he got banned by the medical profession, who didn't like his methods. But in spite of that, it proved useful, because he started to realize that some cancers, rather than the solid tumors, the ones for lymphomas, the myelomas, leukemias, needed a slightly different dietary treatment, and they responded to that. So that was William Kelly. So that gives you an overview of some of the diets people have used, and there's more in the book on that. But what I think is interesting to me is that there's some research being done by Professor Beliveau in Canada, Toronto, I think it is, where he's taken food extracts and he's used it on live cancer cell cultures, and showed the effect of these foods on cancer. And some are pretty powerful. I mean, using garlic on medulloblastoma cultures, it's effective in killing the tumors at 1 part in 1,000. Now, it obviously depends a little bit on the type of cancer, but there are some stars in the nutritional, in the food world, if you like. Top of the list, probably, I think most listeners would be interested, is mushrooms. Mushroom extracts have been used in the Far Eastern Japan for cancer treatment anyway, but mushrooms have powerful anti-cancer effects. Second and third equal, I would say, are probably the alliums, things like garlic, leek, onions, and the brassicas is another powerful group, which your Brussels sprouts and your cauliflower and your broccoli, things like that. But it's not just vegetables. Certain fruits, particularly berries, certain spices. We've all heard of the healing powers of turmeric. Certain herbs, they all have these healing properties, and they're sort of vindicating, if you like, the work done by some of these pioneers like Kelly, who showed that, you know, food is a powerful healing force, as Hippocrates said long ago, I suppose. And perhaps I should also mention that equally some foods have the opposite effect. We all know sugar is bad for us, but it's basically the food that cancer use. So if you've got cancer, you don't want to be taking sugar. Milk, if you've got a hormonal cancer because of the hormones in milk, hormonal cancers being things like prostatic, breast, ovarian cancer. For instance, the 20 out of 24 studies of milk and prostate cancer show that milk makes the situation worse. And I don't see many people with prostate cancer being told that, which is a pity. There are some other foods. I would say the seed oils, most processed foods are made from those, and they use for cooking, obviously, these are problematical as well. So there's problematical foods and there's good foods. And just having that knowledge can make a big difference to healing. With autoimmune disease, like I've talked about MS in the chapter, there's a slightly different emphasis, but I won't go into that at this moment. But basically, there are healing foods and there are harmful foods.
It is really interesting. I mean, that aligns quite a lot with obviously some of the, I guess, the common messages coming out in nutrition and nutritional therapy these days in regards to eating the different colors and the phytonutrients that are found in there, and the importance of diversity within the diets as a way to incorporate a lot of these different foods that you've been listing, including herbs and spices.
Yeah, I mean, that's a very good point, Alec. The interesting thing about a rainbow diet is different foods act at different stages of the cancer pathway.
Oh, wow.
Unlike drugs, which act on one stage of the cancer pathway. So if you use all the different colored fruit and vegetables, you're getting lots of these phytonutrients, as they're called, and polyphenols, which and we're only beginning to understand. And I think over the next 10, 20 years, we'll learn a lot more about the ability of these compounds to cure disease. And it's very difficult to put these in a supplement because some of them are short acting. A lot of them work better when they're combined together. Perhaps the best known of those is turmeric and pepper, but there are others as well. So if you're taking it in a food, you're getting this combination and you're getting the active metabolites, if you like. So yeah, food has got a lot to offer us. Hippocrates was right after all.
Yeah, absolutely. Brilliant. Is there anything else to sort of add from a dietary perspective, or are we ready to maybe move on to a different aspect?
There's obviously, you could talk for a long time on diet, but maybe it would be a good time to move on to one of the other sections.
Sure. Choose which one you would prefer.
Well, I'll take it in the order of the book, shall I, Alex?
Okay.
And I think it's probably the easiest way of doing it. Let's look at the mind. We already know that people with cancer looking into this. We've heard about visualization, for instance, which has been used by cancer survivors. But there's much more to the mind than visualization, although it's a useful technique. Let me start with what I think is probably one of the most astonishing cases of healing I've come across. That's the case of Evie MacDonald, who had motor neuron disease. Basically, as you know, motor neuron disease is a lethal disease, killing within a few years. And it's a nasty way to go because you basically your muscles disintegrate. She wasn't expecting to get better. She did, however, want to make peace with herself. She realized that she had a long list of things she hated about her body, a long list of things she hated about her life, a lot of people she didn't like that much either, and not much she did like. So she decided, and the interesting thing is she did this for only 15 minutes a day in front of a mirror. She started to look at the things she didn't like and sort of release them to the universe, so as to speak. And she would also forgive the people she didn't like, and she would pick something she did like about her body. And each day, slowly at first, the list of things she didn't like got smaller, and the things she did like got bigger. Now, there came a point one day where she simply couldn't find anything she didn't like about herself. And she realized at the time, the list of things she did like was quite large. And at that point, she had an overwhelming feeling of love and compassion for her own body. And she started to get feeling in her legs. And soon after, she was able to walk. And from that day onwards, she started to recover and has never looked back. So it gives you some idea of the power of a mind, and some would say spirit, to heal the body.
Mm.
Now, there's lots of ways this can happen. I mean, some of it is fairly well known. For instance, if you go into a relaxed state, and Herbert Benson's done work on the relaxation response, which is very like meditation, but any sort of relaxation would do it. Basically, you produce quite quickly a very long list of chemicals which are healing and anti-inflammatory. Equally, you upregulate genes which help in the healing process. Unfortunately, if you get stressed, the opposite happens. Quite quickly, you produce a long list of chemicals which cause inflammation in the body. And in addition, they upregulate the inflammatory genes and downregulate the ones for healing. So we know that your state of mind affects your ability to heal almost moment to moment. But perhaps it might be interesting to take or look at the idea of creating your own reality, which has been popular in recent years with books like The Secret. But I'd like to go a little way back in time before these were popular, to a man called Neville Goddard, normally known as Neville. And he would say things like, assume you have what you already want. And that assumption, though false, will harden into reality. Now, these are fine words, but do they actually work? Well, Goddard at one point went to see a man in hospital, a young man with a young family who was wasting away, and he'd been told he was dying of heart disease. And Neville had an inspired suggestion for him. He asked this man to imagine the face of the consultant looking at his notes, shaking his head, saying, "I don't believe it. I don't believe it. You're completely healed." And perhaps having nothing better to do, he focused his mind on this. And eventually, the consultant did say exactly that, and he was completely healed. So again, it gives you an idea of this extraordinary capacity of the mind to heal the body. Now, this can be done in a variety of ways, and I guess that could be a bit confusing for the listener, because different people have done it in different ways. Some have found a purpose in life. Some have let go of a traumatic memory. In one case, healing a man from cancer in days. Some have had healing dreams. Some have used more standard things like affirmations and visualizations. But that power of healing is through the mind is there. I would like to add here, perhaps, was a Canadian study, which I think is important, because it shows that although this power of the mind is, well, it is powerful, you've got to use it. They did a study of people with a severe cancer, metastatic cancer, again in Canada. And what they found is people who were highly involved after 2 years were doing extremely well. In 90% of those were doing extremely well. The people who weren't motivated to do it much, they didn't do so well. So sure, it works, but you've got to do the work. So that gives you a sort of overview of some of the things in the mind chapters and how it can help almost anyone, because we can all use our mind in a particular way.
Yeah. And I guess, to reiterate this concept that there's lots of different ways to do it. And hopefully that can be, I guess, empowering for people, that there isn't sort of one prescriptive way that they have to get right in order to have this healing from a mind perspective. But there's lots of different tools that we could explore and tap into. You've mentioned things like dreaming even, and the role that can play, which is a really an area that I'm particularly interested in this idea of lucid dreaming and the role that it can play within health and healing.
I mean, what you've said is absolutely right. There's more than one way to heal. And that's one of the things survivors have told us. For instance, I've got cases in my book of metastatic breast cancer healed by diet. Jane Plant did that, mainly cutting out milk. But also, there's another lady who used mental techniques. She developed herself type of visualization to heal metastatic breast cancer. So it's interesting that we can heal in more ways than one, even when the chips are down.
Yeah, absolutely. And, you know, a big theme, it seems, within your book and the work, and you mentioned it at the beginning, I guess, is just the idea of the overall environment and how conducive that is to the healing process.
And maybe that brings us on to toxicity. Yeah, there's a section on toxicity, and I would say at this point that I don't think that any survivors have used that as their sole method, unless you include fasting, juice fasting, which obviously it has a nutritional and perhaps an energetic element as well. But toxicity is a growing problem. Let me just give you some insight into that. I've mentioned I was interested in the incinerators, and sure, coming out of the chimneys of the incinerator, you'll get all this toxic smoke, equally from the exhaust from your car. But we tend to think that disappears, but actually it doesn't. Eventually it's going to land somewhere. So if it lands in the sea, it would eventually get eaten by the tiny fish, or they would take up the water. And each step in the food chain, the toxicity increases. So it increases as the tiny fish get eaten by the small fish, by the medium fish. By the time you get to the dolphins, you've got a 13 million fold increase in DDT. So what we're seeing, because it's going up the food chain and we eat the foods, is those chemicals are coming back to us like a boomerang. Now, we're quite high up in the food chain, particularly if we're carnivores, which most of us are. But there is a being higher up the food chain than us. And I'm not talking about any man-eating monster here. I'm actually talking about the human fetus, because mum concentrates the toxins again in the womb. Now, if you want to reduce your toxic load by 50%, you could have 50 saunas, as long as you have a shower and wash off the sweat afterwards. And it's quite an effective way of reducing toxicity. However, equally, if you're a mother of the first child, you will reduce your toxic load by that same 50%. But this isn't so great, because it ends up within the firstborn child. Other subsequent children do a little bit better, but a lot of toxicity gets overloaded. So you can see with generation after generation, we're getting more toxic. This is a problem which is hardly recognized. Yeah. Now, I give some idea, because most people think, well, I don't work in a factory where there's toxic chemicals. I'm probably not exposed to this stuff. Well, you might be surprised. In the first toxicity chapter, I include a story of a couple that I've called the Joneses. And it's an everyday couple, and they go to one, Mr. Jones goes to work in an office and she goes to work in a school. And what might surprise listeners is the hundreds of carcinogenic, neurotoxic, and endocrine disrupting chemicals they come into contact with in a single day. And in some ways, that's shocking. I think knowledge is power here. If you know where the toxicity is coming from, you can do something about it. Let me give you a couple of examples here. There's been about 33 cases of breast cancer which has been detected in women who keep their mobile phones in their bras. And you can sort of imagine how this is picked up. The lady gets breast cancer and asks the doctor, do you think that could be anything to to do with me having a mobile phone in the bra. So it gets investigated by researchers. However, what about keeping your mobile phone in your trouser pocket? That's not likely to be investigated, is it? Could that have an effect on prostate cancer, bowel cancer? We're seeing a lot of bowel cancer in young people these days, bladder cancer. It could easily have an effect, and nobody's being warned about it. But if you know that, it's something you can do something about. Equally, if we keep things in plastic containers, the plastic can migrate. Now, many years ago, about 20 years ago, no, actually, it was actually in the 1980s, two doctors, Dr. Soto and Sonnenschein, were working with breast cancer cultures, and they couldn't work out why they were growing because they put nothing else in the mix. They just put these cancer cultures in the test tube. And by a rather complicated set of observation, they worked out it was the plastic itself which was causing the breast cell cultures to proliferate. Now, if you say keep milk in a plastic container, plastic migrates into fat particularly, that's not a great idea. If you've got a hormone-related cancer like prostate or breast cancer, what if you keep a water bottle? You put it in the back of the car, the sun's on the car, it heats up, more particles get into the water. That itself could stimulate the cancer. And people don't think about these things. So just having that knowledge can give you some protection or better odds if you're fighting a cancer of this nature.
Yeah, brilliant.
So that's a brief summary of the and there's much more, of course, with toxicity, but it gives you a brief summary of why it's important in the modern world, really.
Yeah, no, definitely. I imagine you're familiar with Dr. Jenny Goodman.
I am, yes.
I thought you might be. So I've spoken to her about this concept of toxicity as well. And as you say, I think knowledge is power. And I think the great thing about this, as you've just said, is there are so many things we can do day to day in regards to kitchen stuff that we use, etc., that it is empowering. I think sometimes people think it's doom and gloom when they hear just the statistics and the kind of the concerns over these toxicities. But I just love the fact there are so many simple things we can do to start to minimize our exposure as well.
Yeah, we can minimize our exposure. There's two aspects to it. Minimizing exposure, as one of the chapters is devoted to that. I have to say it's quite long because there's so many causes of toxicity, but also there's a shorter one on reducing your toxic load, and that can be done as well.
Yeah, so you use these terms sort of reducing and releasing, which I thought was a great kind of way to think about it.
Yeah, I mean, that's what it boils down to, really. Yeah.
Brilliant. All right, and then the energy side of things.
Yes, energy is interesting. It's perhaps a more difficult one to describe, but we have known since the beginning of the 20th century, really, that every creature on the planet has an energy field around it. What's less widely known is that before you get ill, before you get any symptoms at all, you get a change in the energy field. Equally, before you start to heal, you get a change in the energy field. And there are fairly simple things you can do to improve your energy. But perhaps I can take an unusual case, so as to speak, of dealing with energy, because some people have the ability to transmit energy. So what I'd like to do is talk about a DVD I saw some time ago, which was filmed in Beijing in China. Now, in China, if you get cancer, you're probably going to be treated in the Western hospitals. However, if you're not doing so well, a lot of the people will go to the traditional hospitals called medicine-less hospitals. That's an interesting concept over here, isn't it? Medicine-less hospitals, and where they're taught about diet, they're taught about exercises, but they also have qigong healers there. And in this particular video, they show a woman with bladder cancer, and in the room there are 3 Qigong healers and also a technician who is monitoring the ultrasound, which is showing the bladder cancer. And it was a 3 centimeter, quite a big bladder tumor. Now, you may not know, but bladder treatment for bladder tumor, removing the bladder, is a pretty barbaric procedure over there. It's not something you'd want in a hurry. Anyway, in China, here in the medicinalist hospitals, they did things differently. And basically what we see happening is after a while, the 3 healers start to chant. And what they're chanting is, in English, would be already healed, already healed. And they continue to chant. And as you watch the ultrasound, what you see is after about 2.5 minutes, the tumor starts to quiver and then completely disintegrate. Now, after this happens, basically the patient and the healers bow to each other and they just wheel in the next patient. This is done on a large scale, and they've got figures for how they do. And providing the patient keeps to the exercise and the diet, they have 95% success rate at 5 years, which is remarkable. Wow. And in fact, a German film crew actually saw a cancer being disintegrating within 60 seconds. So it's something which is hard to contemplate over here. But what I'd like to say is it's not just something that can be done in China. I give a few examples of my book of group healing. But if I can take a particularly interesting one, it's the case of Amy, a 17-year-old girl called Amy, who has terminal leukemia. And her dying wish was to attend a motivational seminar by Mark Hansen. Now, it was about 1,000 people at this seminar, and Mark knew Amy was there, and he had an idea. What he did is he asked for people to pair off and practice healing on themselves, telling them they all had healing ability, but about in 5% of those people, it was exceptional. Later, he got Amy, a very frail looking Amy, on the stage. And he asked the people in the audience to send their healing energy towards Amy. And this they did enthusiastically. The outcome of this was 2 weeks later, she was discharged from hospital unexpectedly. And 2 years later, Mark Hansen got a phone call from Amy saying she was alive and well, and she was just getting married. And this story really struck with me because I thought, you know, many people would like to be involved in this sort of healing experiment. And if we had enough people with healing intent, I think we could heal almost anything on the planet. And certainly some of work on the intentional experiment is not only is the person being healed, they get the benefit, but the healers also seem to benefit. So it's a win-win situation. So with energy, anything's possible, really.
That's amazing. And it really gets you thinking about, I guess, just what comes to mind for me is like a lot of people who I've never heard talk about energy before have used that term over the last year with lockdowns and people kind of feeling like an energetic shift that has happened, whether it's kind of a heavy one when just so much of the population are struggling. But that really comes up for me, this idea of, you know, we are interconnected and there is an energetic level to this existence, as it were.
Yes, and there's some evidence, and I talk about this a little in the book, when one person goes on a healing journey, others gain from it almost unconsciously. In fact, a species gains when one member of that species learns a new trick, so to speak, and healing is just one of that type of phenomenon, I guess.
Yeah.
Perhaps I should add that there is a final chapter which is called Putting It Together. And one of the interesting things about this is more is better. And if I take you to the work of Dean Ornish, this was done about 20 years ago, and it was probably regarded as a bit wacky at the time. And he took patients with prostatic cancer who they were using what's called watchful waiting. Now, if a cancer's not too severe, you can monitor the progress of the cancer with the PSA test. And he was able to do this and put some members in an experimental group, and some just did routine therapy. So he was able to compare the two groups. Now, as I say, at the time, a lot of these things were probably regarded as a bit wacky, particularly by those by cancer therapists. It included a vegetarian diet, it included walking, it included supplements, it included stress release, yoga, imagery, relaxation, support group, things like this. But after a while, there was a clear difference emerged between the two groups. The PSA rose on an average 6% in the control group, and went down 4% in the active group. But perhaps which was more interesting from my perspective in the last chapter, in that more is better, is that the group who did more of these activities, they were able to inhibit cancer cells by a massive 72%, whereas the people who were only doing some of it had a 7% reduction. So clearly more is better here. I think there is one caveat to that. I think if you're doing so much that it's stressing you to do it all, that would have a negative effect. But generally speaking, the more healing activities you do, the more likely you are to heal a disease.
Brilliant. That's fascinating. There are so many amazing cases there. Are you familiar? I'm just, something that was on my mind on the mind section was, are you familiar with Dr. Gabor Mate?
I'm not actually.
So no. You would probably be really interested in his work. And the reason why he just comes to mind is when you were talking about the mind, he kind of just cites some studies around personality types and specific conditions, and how there's a little bit of research suggesting that, you know, our general personality may actually increase our risk of certain conditions. So there might be actually like a rheumatoid arthritis personality type. And certainly I've read around things like chronic fatigue syndrome, there being certain types, the achiever type, the trauma type, the helper type, and things like this. I'm not sure if you've come across anything like that.
Not specifically, but it does bring me on to, in a way, the final bit, that what is the process here, which someone who gets better uses. And it brings me to Louise Hay, who you may know. What her way of healing was that each disease had a message, and if you could understand the message, you could start to heal. But I think it illustrates nicely the process that survivors go through, and there's 4 stages. The first is a decision. And the first is the decision, I'm going to get better. And I would say not everybody makes that decision. A lot of people just say, oh, I'll do what the doctor tells me to do, etc. But some people make a decision, I am going to get better. Now, to do this, the second of the 4 stages is you've got to believe it's possible. Now, you might not at this stage know how you're going to do it. In the case of Louise Hay, she got cancer herself. Although she was advising other people on how to heal with success, she got cancer herself, which was pretty devastating. But she had a belief she would get better. She didn't know how she was going to heal herself. She believed the universe would come up with answers. And the third step, once you believe you can heal, is persistence, because it's often 3 steps forward, 2 steps backwards. And for Louise Hay, she called it doing the work. You've got to know what to do, but you've got to do the work. And if I can talk briefly about another healer, Bill Bainston, who'd done some fascinating work on healing with animals, but he also used to treat cancer patients. And he treated a number of people who were believers, so as to speak, in healing. And what he couldn't get his head around is some of these people did really well, and he would say, come back, you need so much more healing. And he never saw them again. They just disappeared. Whereas the skeptics, some of the skeptics, believed there was no chance they were going to get healed. They did really well, so they kept coming back and they healed. And again, it's this step 3. You've got to do the work if you're going to get better. And step 4, and this is, I think, where maybe I come in a little bit, is having the knowledge. And I put together the knowledge of people who've healed by various methods. And hopefully that knowledge will help other people who find themselves in this situation.
Yeah. No, I think it's an absolutely brilliant resource for this sort of situation. So I can't recommend enough that people check out the book. You've obviously been very kindly to give us a discount code as well. So that will be available for everyone listening and watching as well.
Thank you.
Is there anything that you would like to conclude with, Dr. Thompson?
I think one thing I'll conclude with is that I've got a great admiration for these people who I've called survivors, because they've done what modern medicine has not been able to. I mean, we've spent over $1 trillion, haven't we, on trying to find a cure for cancer, and with no sign of success at the moment. And yet these people have cured themselves. And you might ask, how is it possible that people with no medical knowledge achieve this? And I think there's a trend here, actually, of people taking, and I've seen this over the course of my career. At one time, people would just do what the doctor told them, which, looking back, wasn't always the best. And now many more people are taking health into their own hands. To give you just an example, from diabetes, I mean, diabetes is less serious, but it's still, it's gone up threefold in 30 years, takes up 10% of the NH budget, 6% of hospital beds. And most doctors will tell people with diabetes, you've got a lifelong condition which will gradually get worse. Now, talking about people who take health into their own hands, I had a patient come to see me, and he asked me for some advice. He felt he wasn't doing too great. The standard advice at the time was a low-fat diet. I never believed in that, and I gave him my leaflets. You need a low sugar diet, etc. Anyway, to cut a long story short, he took no notice of me, but he did his own thing. And what he did is he did alternate day fasting, which we now know a lot more about, lost several stone in weight, came off his drugs, lost his diabetes. So that's talking about patients taking health into their own hands. And we've seen that again with cancer, and we've seen it with other diseases as well. And I think it's a trend which I like, and I think we need, really.
Yeah, that's so interesting. I guess another example of how there's just more than one way to heal and go about these things.
Yes, absolutely.
Brilliant. Dr. Thompson, thank you so much for sparing the time to come on the podcast. It's been really great to hear all of these case studies, and I really hope that for our listeners it provides hope for anyone that might be in one of these sorts of situations or a similar situation, but also, I guess, hope for people who might be suffering with, if I use the term, less severe health conditions, who still might be able to listen to this information and find it empowering, that if there's these sorts of experiences that people are having with kind of certain types of cancer and things like this, that there's hope for all these other conditions that might not be as acute, and just in regards to the suffering and their capacity to heal.
Absolutely. I totally agree with this. It will help prevent disease and it will help in less severe disease because they're basic principles of health. You can
Mm,
always eat something which is healthier or take away something which is not healthy. You can always have a positive healing thought. You can equally do things to increase your energy, just breathing deeply, grounding, what have you. You can take measures to reduce your toxicity. Yeah, these apply to every disease under the sun.
yeah, perfect. Dr. Thompson, thank you very much. It's been brilliant.
You're very welcome. Thank you very much for having me on the program.